Well, hi guys, I'm Dr. Kay DeRayraj. I am a facial plastic surgeon and head and neck surgeon in Los Angeles at Beauty by Dr. Kay on Instagram. And I'm so excited you're joining me to learn and watch my jawline technique. In case you didn't know, I am kind of known for my jawline technique, and this technique is world famous. I wrote a textbook chapter this year with Dr. Rod Rorick all about my jawline technique, and I want you guys to master and learn this. To learn it, you need to know your anatomy, you need to have confidence, you need to have a good hand, and a beautiful model. It doesn't hurt. This is beautiful Bailey, who works with me every single day. Bailey, thanks for being amazing. You ready to have a jawline transformation?
Yes, can't wait.
Okay. Well, so one thing we notice about Bailey is that she has a very petite chin and an under-projected mandible. So I want to give her a long, strong jawline. And that's going to help pull up some of her neck laxity and give her some more projection and give really strong and beautiful angles of the mandible. So we can give you a little more projection, and it's going to help hide some of the double chin. Later on, we can always do some other treatments to dissolve submental fat like Kybella or neck lipo, but today is all about bony contouring. So I'm excited to show everybody how we can create definition, pull back heaviness, and give the appearance of a much more contoured, elongated jaw for you. It's going to be great. So let's start with some marking. Now typically I am a big fan of calcium hydroxyapatite or Radiesse in this area, and this filler is currently not FDA approved for use in the jawline. However, you never know, we might get some approvals soon. Until then, remember that we can use products safely off-label any way we see fit as injectors once we feel comfortable. There are two areas here that I've kind of accentuated. Here's her jowl, this little volume here. Here's her pre-jowl sulcus, where we're going to need to add volume. Here's her post-jowl sulcus or antegonial notch right in here. And she's a little bit blunted on her chin, so we're going to add volume all the way forward to give the appearance of more chin projection as well. I want to recreate a strong angle of the mandible. Normally I'll numb patients. I'm going to erase some of the lines that we just drew. I think it's important to pre-plan your pathway and think about what you're doing. So mark twice and cut once. That's what we do as surgeons and as carpenters and as injectors. Mark and then cut. I'm going to feel the very back border of the angle of her mandible. The most posterior aspect of this L shape is where the first bolus of filler needs to go. So if we inject directly in that corner, and we're going to give a 0.5 cc bolus of filler. Sometimes it's difficult to feel the exact projection of the bone, so we might have to go in a couple times till we get just the right spot. So I've poked twice and I still feel that I'm in soft tissue, so I'm going to try go in a little bit more posteriorly and superiorly. Miss Bailey, you're a little challenging here. There we go. Okay, now I'm in. So that's a good example actually of feeling like, okay, that was too superficial, too much soft tissue, too much soft tissue. Now I'm directly on bone. It's very firm. It's not moving. It's the most posterior aspect, and I'm going to give a 0.5 cc bolus here. More volume. Maybe 0.3 actually instead of 0.5, just because I want to give that really nice accentuated pop for her jaw there. I'm going to go forward a little bit and give another small pop of support there. I'm going to recreate the posterior ramus of the mandible here by putting a subcutaneous line of filler to create the appearance that she has more strength in her jawline than she actually has. Let's put 2 retrograde linear threads, 1 and 2, just like that. And then let's feel for her antegonial notch. Palpate the facial artery and pull it back out of the way. And be very careful with this injection technique. This artery is responsible for blood flow to the entire face. I'm going to give a small bolus directly on periosteum. If I'm not confident about my anatomy or my techniques, I will definitely use a cannula in this position. I will recommend a cannula for everyone who's starting out. Calcium hydroxyapatite products are not easy to reverse. In fact, they're not dissolvable, and so you need to be very confident in your skill set with them. I'm going to also give a few linear threads here to create the angulation and definition along this front border of the jaw. How's the sensitivity so far?
Feels good.
Really?
Yeah.
Okay. Excellent. Excellent. It shouldn't feel too painful. Just a couple of points where when we touch periosteum, it's slightly sensitive. And so treating subcutaneously, your needle depth is quite superficial. We never want to inject the jowl fat, ever, with gel fillers, with calcium fillers, with any fillers. Leave the jowl fat alone. This is very sensitive. Any touching in here is going to trigger swelling. And if you put filler inadvertently in the jowl fat, then good luck, because you're going to have a patient who calls you every day for life until the filler is gone. Now we're going to feel the pre-jowl sulcus and feel where the facial artery crosses and pull that posteriorly and give a small bolus of support under the mandibular ligament. And that is a very important one to prevent this little indentation that sometimes makes a divot where the chin looks like it divots in. So we can see that actually already looks better. I think she needs a little touch more right there, so we'll do one more spot. A little quick pinch. 1, 2, 3. Not too sensitive?
Just a little poke.
Okay, good. Try to put pressure on things that are oozing so we don't get too much bruising. On periosteum here is a very safe injection plane. A little small bolus of support. And then last, most important, one of the most important steps is some chin projection. So the anterior border of this mandible, as it conjoins with the mentum or the chin, there's always a little spot of recession. You palpate, make sure you don't feel submental artery or any arterial crossing. We'll go right on periosteum, and then we'll give a very small bolus of 0.1 cc's just to support the chin and the angulation there. So that gives a really pretty stronger looking, better looking jaw, and actually helped diminish the appearance of the submental fat right there. I think that's a nice result. Let me show you guys what this jawline looks like. So take a look at this jawline, softer, more doughy, little indentations. And then let's take a look at this jawline. Longer, stronger, looks like a nice defined jawline. I think that looks so impressive. We can also do one of these days some masseter Botox. You must be grinding and clenching. We can see that she's super prominent in her masseter muscle. She's getting some squaring in here. So I do think it would look very attractive to give her some lower face slimming by doing some masseter Botox and take away some of the squaring of her lower jaw. So that is going to be one of our future projects. With her jawline filler, we are going to give a little definition at the angle of the mandible. 1, 2, 3, a little pinch, and a bolus of support to create a nice sharp angled, contoured look. This is so popular. It's one of the most popular injection techniques in my office these days. And this is truly something as an injector that you need to learn and master, because not only is it pretty, and people want it because they want that photogenic Instagram jaw look, but it's also important to do to support lower face heaviness. So for younger patients, it's beautiful in terms of creating the desired look. For older patients, it takes the jowling and pulls it backwards, lifts heaviness away from the face, and creates a very nice improvement in lower face contour. This is one of the areas that as we age, the angle of the mandible becomes diagonalized, bone density change occurs, so we lose that square. We develop an angulation here. We get a very deep antegonial notch with aging and a large pre-jowl sulcus. And that's what makes the jowl tissue droop. When these areas are filled, the jowl is tightened backwards automatically. So I like this as an anti-aging lower face tightening procedure. It's not surgery. I cannot promise the results of surgery with filler. And I think that patients feel that filler can do everything. It is a gel like toothpaste, and it can only do what it can do. But when placed with good precision under anatomic landmarks, like under the mandible ligament, at the angle of the mandible, at the posterior ramus of the mandible, the results can be quite pretty and almost look like an implant. Remember that calcium hydroxyapatite or Radius is an implant. It's FDA approved as an implant. This is an 18-month product, creates new collagenization, so it's very effective for biostimulation. It's also excellent for longevity, And it's going to change the support long term. When we touch the periosteum with the needle, we are generating more collagen production. And we are going to generate brand new tissue here, which is much better than filling up old tissue with gel. I'd rather have new collagenization grow in these areas. May I have the other half of this syringe? So for me, I use a lot of calcium hydroxyapatite or Radiesse for facial contouring. It's FDA approved and indicated for the cheeks. It's used off-label at the moment for the jawline, but I think the idea of bony stimulation, biostimulation of collagen, type 1 and type 3 collagen is excellent. And I also think that this is something that if you master in your practice, you'll be so much less dependent on hyaluronic gel fillers. Gel fillers are terrific for the soft tissue areas of the faces, like the lips, the under eyes, the nasal folds. They are not going to be effective if that is all you know how to use. So I want all injectors to be versed in all the different types of products out there so that they can have a full armamentarium of treatment options. And one of the best things that you can learn is how to use this product for bone contouring. I truly think that is going to be one of the next frontiers of our industry, is not just putting gel fillers to create soft padding everywhere. The face in America does not need more padding. We have a population that's 70% mild obesity or severe obesity, and we don't need a fuller, rounder face. You need to look at your patient's face, and those few patients who are thin and athletic that have loss of soft tissue padding, they benefit from the gel fillers. The patients that have volume and need to have angles, they need a product that can give angles. And I think that these products, the calcium hydroxyapatite and Radiesse, are really truly the leaders for these products that give sharp definition, sharp angulation, and bone stimulation, contouring ability. This is literally the future, is bony contouring to fix bone density change as we age. And that little bit of projection on her chin is going to be very meaningful for her. It gives her a tightness, takes away lower face submental laxity. We're able to take the laxity of the submentum and pull it backwards in a very important and meaningful way. This is literally what you can accomplish with threads, and faster, more efficiently than threads. Let's have you take a look. I think we'll give you some chin projection too. Can't wait to see.
Oh my goodness.
It looks great, doesn't it?
Wow.
Really nice, and
Love it.
yeah, I think very important to not get masculinization of the chin and lower face. The patients who have filler placed indiscriminately can sometimes look thick and masculinized, and I think I want to emphasize tightness, slimming, and just kind of overall beautification. Our last step is going to be a little bit of filler right in her chin for chin projection. Since she's petite, and we can give her a little bolus of filler right on the most advanced portion of her chin. At the pagonian, we'll add a little touch. In the submental fat pad, I'm adding a little touch for projection. I also think we can pinch and pull forward on the submental labiomental crease and add a little touch of filler in the labiomental crease. I always think that makes the lips look better as well, because it takes that shadow away. And let's give a little bit for lengthening as well. All the time being directly on periosteum in the midline is a very safe plane, and making sure that we do small aliquots so we don't overcorrect. Excellent. I think you're going to have really lovely results here. I make a point of asking patients if they'd like to have a V-shaped chin or more of a soft, rounded taper. I think a slight V looks nice on you. What do you think? You think so?
I think so too.
Okay, good. We're on the same page. Last little drop of filler right there, and that looks gorgeous. So overall, that's the jawline technique with attention to detail, accentuating the angle of the mandible, making sure we define the posterior ramus, filling the antegonial notch and pre-gel sulcus, bringing our injection all the way anterior to the chin, and just really feel confident about using Radius for all kinds of applications, especially for mid-face. I love it for the lower face off-label use, and I think that your patients are going to require you to master a good jawline technique. If you're out there and you're doing injectables and you're not solid and comfortable on your jawline technique, this is something I want you to master. It's going to really transform your practice, and it's going to give you so much satisfaction as an injector to be able to do this for patients. I hope you loved that.